Okay, we're recording.
Great. All right. I'll get started then. My name is James Pepper. I'm the chair of the Vermont Cannabis Control Board. Today is August 10th, 2022. And this is, I guess, technically a public meeting, so I will just call it to order. It's really today is meant to be a discussion with the people who care most about the medical program and really brainstorm about the future of the program. I've been kind of historically an outside observer of the medical program. More recently, we've taken a deep dive into it. And I just wanted to say a few things at the outset to hopefully just level set. We do, in fact, we sent out a survey to patients earlier this year, and I know that there's a little bit of selection bias because we're talking about current patients, not people that could no longer afford the program, or there was too many hoops to jump through, so they left, or people that never were able to participate in the first place. But we did hear a fair amount of satisfaction with the kind of 5 existing medical dispensaries. We know that the way that the system is set up, that it is inaccessible, it's unaffordable for many Vermonters, and we've heard the complaints about the quality of the products. Just, I need to get that out there. We don't need to be reminded of those. We know that these problems really are the natural outcome of the limited number of licenses that have been available on the medical side, the lack of third-party testing, and all the hoops that patients need to jump through in order to get on the registry and then stay on the registry. We also know that with the onset of adult use, the board has real concerns about some of these problems being exacerbated. And we can't just allow the status quo to continue for, another year. So historically, the legislature has been very reluctant to tinker too much with the medical program. Common sense reforms have been rejected, or they don't get a hearing. And I don't want to raise expectations here. I mean, we put forth a bill last year and it didn't even get a hearing. But I think this year might be different, and maybe I'm just being naive, but, about a third of the legislature retired this year. And that includes a number of people who historically have not been sympathetic to kind of cannabis or the needs of patients. Also, just to kind of turn back to this onset of adult use, like there is a, urgency that in this moment that demands action. So Kyle, Julie, and I brainstormed a few ideas, both last year after the kind of input that we heard, and this year. And we'd like to present them here. We'd like to solicit your thoughts. This is really for us a fact-finding discussion. We're not trying to kind of put our finger on the scale in any one direction. We really just need to hear kind of how the people that are most impacted or care the most about this program want to see it evolve. Before we get into that, I just want to mention a few kind of basic points about the structure. This is an open meeting. It's being recorded. It's going to eventually be posted to our YouTube page. If you have any concerns about your privacy, whether if you're a patient, you don't want to be identified, or if you don't want to talk about your conditions, you can always change how your name appears on the screen. You can always exit out of this meeting altogether and watch the meeting when it's on YouTube, and then kind of submit comments to the board through our portal, through our web portal. So again, our plan is to pose policy ideas to the participants here. If you'd like to discuss that specific policy point, please raise your virtual hand. If you join by video, we'll try our best to call on you in the order that you raised your hand. We'll move then to people who join via phone. We're going to try our best to let people talk for as long as they want on a given topic. You can make repeat comments if you want to, but we're going to try and prioritize people, first-time commenters over people who have already commented on a given topic. I have no idea how engaged people are going to be today. We thought that we would schedule an hour. We do have a meeting at 3:00, so we can't go too far over. So I will potentially use my discretion to either kind of, limit multiple comments or try and impose a time limit if we're just not getting through kind of a lot of ideas. And again, we do have another one of these scheduled for 6 p.m. tomorrow, and the links to that are available on our website. And just one last point, I know that the medical program, people take it very seriously. People have an emotional response to it. Some people really don't think cannabis has a place as a kind of any therapeutic effects. Just please understand that, we're trying to solicit information. We're not trying to have kind of a debate about certain issues. So please be respectful of other participants' points of view. There will be a separate meeting where we kind of consolidate our thinking on some of these and really formulate a policy proposal for the legislature. And that can be a time where people really debate whether or not we're making the right choices. So anything, Julie or Kyle, that you want to add before we just kind of start posing some questions?
I would just second everything that you've said. I think, we've put together a list of topics to be considered. I think, it doesn't necessarily mean that all three of us feel one way or another about each specific topic. We want to hear from everybody here tomorrow, and, so on and so forth. And I can also say that, we don't wield all the power in the decision making here. I think this is one area where I think the three of us wish we had a little bit more discretion. But as Pepper mentioned, we couldn't even get a hearing on the bill that made modest improvements to last year. So I think we at least need to acknowledge that and just keep, we need to look at monumental changes, but just recognize that, and I don't want to sound naive either. I think that there's some momentum, you know what I mean? But at the same time, the further you get away from what's already on paper, the more anxious we're going to make certain folks across the street. And we want to make sure we can make changes to the medical program without something getting sunk, before it even really gets the fair attention that it deserves. So not sure if that made sense, but just keeping us, I want to say in the realm of possibility, because, great ideas come from roundtables like this, and monumental change happens from conversations like this. But as a starting point, I just want to remind folks.
I have nothing really to add. I'm looking forward to hearing what our participants have to say. And I know we have a limited time, so I would love to get started.
Sure. Yeah. So, I mean, the first, I tried to kind of think about this in terms of increasing accessibility, increasing affordability, and increasing quality, and a lot of these, topics cross multiple kind of those pillars. But, the first one that the board kind of feels strongly about is reducing the cost of the dispensary fee, potentially creating tiers of dispensaries, maybe, some with reduced costs, reduced fee amounts. And one idea that we kind of thought about maybe is, having a tack on dispensary license that maybe goes with other license types. So I know that those are kind of nebulous ideas, but when you think about just a dispensary fee costing $25,000, that makes it immediately inaccessible to a lot of smaller businesses. And when you think about just our retail license fee being $10,000, and you have a potentially unlimited client base versus a medical dispensary costing $25,000 and it having a very limited clientele base, that fee doesn't seem to make a whole lot of sense anymore. So I don't know if anyone in the audience has any thoughts about fees or tiering of fees that might be helpful for us, or that you just have thoughts about. So Nelly, can you try your best to get people in the order that they raise their hand?
Yes, I can do that. Meg has her hand raised first.
Hi, thanks, Nellie. So I would agree. Sorry, can you guys hear me?
Yeah, we can hear you, Meg.
Okay, great. So I would definitely agree in terms of lowering the fee. I think your example with the retail license costing $10,000 and having a much broader potential demographic makes complete sense. And with that, I'm hoping that you will also consider changing the schedule with which the medical licenses reapply each year. I think it is somewhat of an arduous process, and it would be great if we could have that align with adult use if possible.
Yeah, that's a great point for sure.
Thank you.
Pauline.
Hi, Colleen here. I agree that we need to be able to have more accessibility. So other retailers, if you're an adult use retailer, you have an ability to have a medical license also. I'm down here in Southern Vermont and I have a lot of experience in our medical program on all different sides. And I think that it's really important. The better we can have more access to medical, and I think it's not only changing our licensing fees, it's like literally we need to it's like hard to become really hard to become a patient here, and it's on the more accessibility we can make it. I think some of those problems that we're talking about with is that we'll be start to eliminate with more competition. So the more accessibility I think will really help that program. And then I also just wanted to add that people are talking about how the problems with quality and the problems with price. And I'm going to say personally, I manage one of the medical dispensaries in our state currently, and I work every single day to ensure our quality and to ensure our prices and to put discounts in place and pricing for all different kinds of things to make it more accessible and more better price with higher quality. And this is years in, and there's people that are doing this that don't, so I don't want it to totally, it's not a bad program. It just can be improved greatly. And there are patients, there's hundreds and thousands of patients that would say that, so it's, I'm really glad that we're having this conversation tonight. I just want to say that too.
Pauline, can I just ask just a clarifying point? I think that I heard from you is if you have a medical license that we could maybe at the board just, tack on an adult rec license. Is that what you said?
The other way around. If you have an adult rec license, to tack on, give an option to allow to get a medical retail license at the same time.
Okay, got it.
That game changer, because then patients can now have better access to the products that will come in the adult use market without having to pay taxes on them, which is a huge problem. It's going to be a huge problem for patients because the medicine and the things that they're going to want are going to be more available in the adult use program probably soon than they are in the medical program currently because it's so small, and they should be able to access that medication without tax in any cannabis store in the state.
Yep.
And I really think that's the way it should be.
Yep. Thank you.
Thank you.
Keith.
Keith, are you there?
Yeah, I'm here.
Okay, great. We can hear you.
Thank you. Thank you for your time today, and thank you for actually putting together a roundtable after many hours of you guys working on the adult program. I appreciate this. As a medical patient here in Vermont for the last 8 years, roughly, maybe 6, 7, 8, I don't remember at this point, I would highly suggest that one, take our medical cards and allow us to go into any adult's dispensary, as long as we have our medical cards to go into these dispensaries and purchase cannabis without a tax, without any issues, going into any of the adult use medical dispensaries in the state of Vermont. And when the other 5 medical dispensaries become integrated, if they choose to, we can go there as well. And because currently I understand we can go to any of the 5 dispensaries in the state of Vermont with our medical cards, even though we still are designating our designated dispensary being one of the 5. And I know out of the 4 of the 5, they all work together. As in Brandon being different, the one in Brandon, Grassroots, Vermont does not work with the other 4. I would also highly suggest you guys take a nice, good, long look at Maine's medical cannabis program. Maine's medical cannabis program this year was rated by Americans for Safe Access as the best cannabis program in the United States, as a B-. Vermont's medical cannabis program was rated a D from Americans for Safe Access. If you would like that information, I'll be happy to email it to the board. Another thing that needs to be increased in the state is plant counts. Plant counts for for medical growers should be 6 plants mature, 12 immature, and endless seedlings and clones, as long as they're not over 18 to 24 inches and not in a flowering process. There should be a gifting program to give it to low-income people in the state of Vermont that are on a list. If there is a caregiver on the list, a list to the board, a caregiver list stating that they are a caregiver and they are willing to donate some of their cannabis to somebody that is in need, that is a medical patient, as long as they're negotiable of a rumination fee to give that caregiver for some compensation for their ability to work and grow the cannabis for somebody else. Another thing I've noticed is that the fee cost for a medical patient is a $50 fee. Now, with taxes coming in from the adult use market, you guys are going to generate millions of dollars. There should be no longer a fee for us to pay the $50 fee. Some of us are very indigent in the state based on medical needs, low-income people, because of our medical necessities. I believe that should happen. Another thing I believe that should happen with the state of Vermont is if we're going to call, we have a medical program. Personally, every single medical patient in this state should be able to go into a hospital and use their medical cannabis if they're being treated for PTSD, cancer, epilepsy, or anything, or even if you're having post-traumatic stress disorder that is by a certified qualifying doctor in the state of Vermont, we should be able to use our medical cannabis in those places at all times and without any restrictions. There needs to be higher protections in the state of Vermont for medical patients as well. We should not be prosecuted or purged if we are pulled over with medical cannabis on us, as long as we are identified our medical cannabis cards to a law enforcement officer. Most medical cannabis patients use cannabis daily. So if there's a saliva test, I personally won't pass the saliva test currently right now in the state of Vermont. If you guys gave me one, I wouldn't pass it. I daily use cannabis every single day of the week. I have chronic pain and multiple other health issues. So I need to use my medical cannabis. And because the generation of cannabis now is not just flower, there's no reason we can't implement it into nursing homes, medical facilities, school grounds for pediatric patients. All need to be in places like that. My daughter has medical conditions. She currently doesn't go to school. She has a seizure disorder. She uses medical cannabis. She is prescribed Expedia from the federal government. It's the only CBD product that has been approved for Dravet syndrome and Lennox-Gastaut syndrome in the United States through what was formerly GW Pharmaceuticals. There's no protections for children to be able to use medical cannabis on school grounds in the United States. If we give it to a nurse or an adult that is recommended and is approved for the medical cannabis program, and they've been certified by a doctor to be able to use their medical cannabis for seizure disorder or any other disorder that is qualified under the medical conditions here in the state, they should be able to allow to use that medical cannabis in that school setting. If it's a parent that has to come to the school and administer it, that should be allowed automatically. Or a doctor or a nurse that's on premises is given the authority to administer that medication with the approval from the parent. There also, for you guys, there needs to be safe vendor training in the state of Vermont. Safe vendor training, not only for the adult use program, there needs to be safe vendor training for the medical program to identify when there's somebody that may be intoxicated, or when you guys have a security issue, or just know how to do procedures and paroles for entering and exiting a building, or you have to have a silent alarm if somebody come in, there's belligerent and they are trying to do something. There's not enough safety precautions in the state of Vermont for that. Also,
Yeah.
my
Keith, thank you for this. We're really trying to have a focused conversation here. And I know that all of these ideas, you've been thinking about probably more intensely than even the board has, or even a lot of patients. We're trying to focus right now on fees, and I do want to come at the end to kind of get a catch-all where anyone can talk about anything that we haven't covered at all. But really, in order to kind of get through some of these, basic points that really, like, the legislature seems somewhat willing to be open to, and then maybe talk about things that we missed. So,
I understand your situation.
but I can tell you that on my list.
Recommendation.
Okay.
Let's make one recommendation. Please give Lindsay Wells the opportunity to remain the director of the medical cannabis program. She's been 10 years at the job. She's very knowledgeable of us patients. She's very knowledgeable of the staffings of the dispensaries here in Vermont, and she deserves the right to be the medical cannabis director, even though you guys have kind of taken that away from her by implementing your Carrie being the enforcement officer. Great to have an enforcement officer, but there needs to be a medical director for the program as well that we can relate to and identify, because sometimes you guys are unattainable due to the fact that you're busy doing multiple other things as commissioners and working with general staff. She's very easy and accessible to answer questions from, and I found that over my time period of being a medical
Great.
patient. So I thank you for your time today.
Yep. Thanks, Keith.
You're
So, so Keith just covered a lot. I know I saw a lot of hands go up. I'm sure people want to talk about caregiver to patient ratios and plan counts and some other issues that Keith discussed. I promise I will get to them. But, maybe I'll just expand this a little bit. The original discussion was around, how we can deal with the dispensary fee, whether we need kind of tiers within that dispensary fee. So it's not just a one size fits all. But I'll expand it also to fees for patients. One thing that we've talked about historically at the board is removing the need for renewals, period, for people with incurable conditions. Essentially, people with, cancer, people with MS, people with Parkinson's. What's the point of asking a doctor to verify that condition is still present year after year after year and making people pay a $50 fee when it's a incurable condition? So if people have thoughts about any of those topics, the fees for the medical patients, the fees for the dispensaries, whether we need tiers within there and what those tiers might be, or what else did I say? The kind of plan counts for caregivers and or caregiver ratios. And I'll just, Nellie, if you could maybe help us. I know that it might be getting a lot of hands at this point.
Yes, we have very many hands that are raised. I'm just going to start at the top of the list and head down as I normally do. So
Sure.
Kathy Demo is up first.
Can you hear me?
Yes.
Actually, yes. I was wondering if I was going to be addressing the correct topic. I have, excuse me, a disabled adult son with a chronic condition. Yes, the renewal fees are burdensome, and also the caregiver fee. I find it very odd that if you have a minor child that's got a medical marijuana card, there's no caregiver application fee, or at least that's what I used to understand, but you do have to do it if they're an adult. And that doesn't really make sense because they need that. You know what I mean? It's like, I feel like it's part of the Disabilities Act, like it's a needed piece of facilitation. So it puts an extra strain financially. And then also today I saw something about fingerprinting that's coming up with a $25 fee for the caregiver application. So I'm just here for that quick blurb. I'm not going to take all your time, but I'm saying the application fees are a bit burdensome, especially for people with disabilities. My son is unable to work or talk or walk, takes edibles for seizures. Yeah, the fees for all kinds of things with disabilities are excessive. So I was really happy to hear that you addressed that in your last conversation, and I want to put my vote in for that.
Yeah.
So,
Thank you, Kathy. Yep.
okay. Thank you.
Caleb.
Caleb, is that me? Hello.
That is
Can
you.
Okay, cool. All right. I want to say this like after a deep breath because it's really frustrating to sit here and listen to former dispensary employees talk about lowering fees when they were selling moldy wheat. And I don't want to harp on this because you guys already acknowledged the quality issues. And I don't want to harp on this, but I've received at least 20 reports of CBD selling moldy weed to cancer patients. And that really just, that makes me, it makes me upset, man. And I've spoken with medical patients around the state, and they are not impressed, man. The overwhelming majority of medical patients I've spoken with in this state are not impressed with the program. The quality, the price, it just, and they're already exempt from the vape tax. They've already had a sort of 8 to 10 year advance on this market to get it off the ground, and they're still growing a subpar product. And quite frankly, I am a medical patient. I have psoriatic arthritis, and I qualify for a medical card, and I will never get one because of people that run dispensaries like that. And I'll leave it right there. Thank you.
Yep. Thanks, Caleb.
Tito.
Hi, everybody. Thanks for having this this meeting. So anyway, I like the idea of an add-on medical license. I think it's a cool idea. I would say no tiers. It would just be a single option as a retailer. You add it on, and but I definitely would like it to be a simple process though. So basically, the customer just shows their medical card. It's just a different button on the POS, and that's it. So it's a smooth process with not too much, not too many added steps there that aren't really necessary. And then I don't think there should be fees on the patient card either, and definitely less rigmarole. I know right now, my wife and I are late right now getting our patient applications to you because I don't know what's going on at my doctor's office, but it's just taking forever to get that paperwork back. And yeah, it should just be something I do once. I mean, typically these problems never go away as we get older. The problems that we all have our cards for. So that's my thought on those issues. I definitely have a lot more to say. So if we have time at the end for other stuff, that would be great.
Tito,
Thanks.
can I ask you a question? And it's just because I know that you're, thinking about retail in the state. If you had an add-on medical license, we can make the regulations match up. So they're not very much different than the regulations for your retail, but would you be able and willing to, maintain a certain inventory of products on the medical side that just aren't available for the retail side? I mean, the high THC solid concentrates, the RSO, things that, might not be totally profitable for a business owner, because, but that's the kind of thing that we need if we're going to add a tack on license to a retailer. Those are the kind of services that we need to provide patients.
Yeah, I would say as a retailer, we want to have whatever products our customers need, whether they're medical patients or rec patients. So if there's a demand for any of these things, of course, absolutely. There would have to be separate inventories here, especially with concentrates to start off.
Okay. Thanks.
No problem. Thank you.
Bridget.
Hi, thank you. I want to agree with trying to remove fees for patients. In all of our years of experience, that's been a big barrier for patients. And I know that when the law was first made, it was the only way that it would get passed because Vermonters generally didn't want to pay for something that they didn't approve of. But I think that there's overwhelming support now for cannabis use in the state. So I'd really like to find a way for the CCB to be advocating for taxes that come from adult use sales to go towards paying for the fees that patients have to pay and the caregivers have to pay. Are we talking about medical licenses being able to purchase product from licenses in the adult use market? That's
Sure.
another way that patients could have access to more and varied products. I think that would be a great idea. And I'm also support patients that have chronic or lifelong conditions that are qualifying to not have to apply every year. Thank you.
Thanks, Bridget.
Yarim.
Good evening. How are you all? Well, afternoon. How are you all? There's a couple of things. Well, first of all, let me ask a question. This is not going to be the first time we can raise our hands, right? We're going to be able to speak throughout, right? Because you
Yes.
have more topics, right?
Yep.
Okay. Perfect.
Yes.
So we'll keep it on topic. First of all, I would like to, pose the question of what, other than being able to buy high THC products, vape products, what makes a medical dispensary different than a rec dispensary? As a medical patient, medical patients could go to a rec dispensary and not show their card and still buy product from them. Okay, and the only thing in their benefit, I think, it's the products that they're buying, as you said. I don't understand why we have to have a different type of license to be able to offer the same products. I am, I want to call it leaning towards the fact that of those THC products, but like you said, offered to Tito, could they have those same products? Okay, they're sitting on a different inventory list, so patients could come in, just show their card, come in, use that to be able to buy not only more product than the average Joe, but different product than the average Joe. That way we can get rid of tiers or any other thought of trying to, mitigate being able to give, patients the ability to purchase product anywhere. So that would mean that if they carry their license, they can go to any rec dispensary that carries those products and they could purchase from them. But I'll keep it at that. Thank you very much for listening.
Thank you, Irene.
Amelia.
Hi guys. So I just wanted to quickly, obviously I support patients with long-term chronic conditions not needing to reapply for their card. I think a potential solution there could be 2 forms of card, and that would be the kind that we have now, which will last you a year, and that would be good for things like short-term injury or short-term illness, and then a long-term card, obviously, like we're talking about. I think that adding on a medical license, like a supplementary license to an existing adult use license, is an awesome idea. And I just really want to quickly say that buying cannabis is a function of the medical program, but it is not the purpose of the medical program. So while I think it's great that we expand ways that patients can buy cannabis, we also really need to focus on expanding the caregiver program and making the cannabis that patients can buy affordable. Because if it's not affordable, it doesn't matter where it is. It doesn't matter who offers it. If it's not affordable and patients can't buy it, then they're still SOL, and they're still going to rely on a caregiver who is currently expected to provide all of the services and products of a dispensary for free, rather than being fairly compensated. So that's all I'll say on that.
Amelia, can I ask you about that, if you don't mind? Sorry, I didn't mean to just turn this into a Q&A, but I just know that you've been forthcoming in the past, but how many plants would you need if you were an outdoor cultivator? So you're only cultivating, during the, growing season in Vermont, to kind of make it so that you had enough cannabis for your kind of therapeutic needs throughout the year?
So I think that when we talk about how much you can grow to last you a year, it's a little unreasonable of an ask, because you're asking that patients potentially hold on to stale product for up to 6 to 8 months, and the longer cannabis sits, your cannabinoids can change from THC to CBN. And you can lose certain parts of the effect that you're looking for the longer that your flower sits there, on top of the risk of it going like moldy. So I would say that if you are using an outdoor grow to supplement your medical need, you would need at least 12 plants to get you through, 3 months. But if you are trying to grow for yourself year round, I would say that outdoor supply at 12 plants would last you until the winter hit, but then you would have to be growing 12 plants indoors every 3 months, because your harvest has to make it like, 2 to 3 months between each other harvest. So you really have to be growing cyclically. And I understand wanting to gear it more toward outdoor for environmental impact purposes, and that's totally fine. But you would have to split your time between indoor and outdoor growing for yourself to be able to do this, which is why I say caregivers who are already cultivating for one patient should be able to cultivate for multiple patients. And in doing so, obviously be fairly compensated, because if you're already doing this and you already have that cycle in place, then adding more plants into that is going to be easier than asking a patient to set up an indoor and outdoor grow for themselves to try to supplement their own medical cannabis needs.
Thank you.
Can I ask a question on that, Amelia? As it
Yeah.
relates to being fairly compensated, I'd like at least a caregiver being fairly compensated. I want to know what you exactly mean by that. I kind of, my ears go up when I hear that, because I know that that's a very special relationship, and I don't want that to turn into a predatory
Absolutely.
relationship. So if you would
Absolutely.
expand on what you mean by that, that would be helpful.
What I mean by that is that caregivers are currently spending thousands of dollars a year to provide free product to patients out of the goodness of their own hearts, and they're doing it. And that's very honorable, but it's not fair. And we would never ask the medical dispensaries to just give product away for free, because we understand they have overhead, and caregivers have the same overhead on a much smaller scale, I'll admit. But being fairly compensated, I don't think being a caregiver should be a full-time job or something that gets you rich, or something that is your 9 to 5. I don't think that at all. But I do think that there are costs associated with being a caregiver that deserve to be mitigated, because what they are doing is providing a service. And I mean, we see it in Maine, the best medical program in the country. Caregivers are fairly compensated for their product. And it works
Are they
really well.
paid by, I'm sorry to interrupt you. Are they paid by patients, or are they paid by state? I'm
I mean,
unfamiliar with that component of Maine's medical program. I'm sorry.
Yeah, I think, there are a couple different ways that we could do it. I think, the way we currently have it, patients should be able to work out a fair and appropriate price with their caregiver to purchase medicine from them. I absolutely don't have an issue with that. I don't want to get too far into it and take up way too much time. We've proposed a 3-tier caregiver licensing plan, and that includes a supplemental license for cultivators. And that includes a standalone caregiver license for a larger amount of patients, on top of expanding the current caregiver license, or the current caregiver card that we offer, from 1 to 3 patients. So I think that, when you say, like, what does that compensation look like? There are a lot of different ways that can look. And there are a lot of different, safeguards we can put into place to avoid that kind of predatory leaning in the relationship. Things like price caps in direct proportion to the adult use market at a certain percentage would help a lot. But I just think that when we talk about patients accessing cannabis, that is not just patients walking into a dispensary and buying cannabis. I think that's a pretty like a narrow view of what should be a symbiotic relationship that individually tailors medicine to a patient's needs.
Got it. I know time is precious, so sorry.
Yeah, and I apologize for maybe making too long of introductory remarks, or only scheduling this for an hour. We do have another one tomorrow. And I know that there's a number of hands up. Right now, we were trying to focus on kind of fees and caregivers, plant counts. Why don't I just expand it to another big topic, and then feel free to just kind of weigh in on any of these. Which is qualifying conditions as well. Historically, the legislature has controlled which conditions qualify for the medical program. These are kind of people without real medical knowledge, you know, in the legislature making these decisions. Minnesota, Massachusetts, Utah, they all have medical research teams as part of their cannabis licensing that get to have a very strong voice in which conditions should qualify for the medical program. So I'm wondering if people have either kind of thoughts about how we should decide new qualifying conditions, if it were to move outside of the legislature, what that should look like, if there's any specific ones that are, you know, obviously absent from the current list of qualifying conditions. And then also kind of a related point is whether we should have reciprocity for people that have medical cards in other states that are traveling to Vermont. I think most people would just kind of, I think, reflexively say yes to that. But I just wanted to kind of put a caveat on there that, you know, unless we increase the supply here in Vermont, then those out-of-state patients are using the kind of cannabis that's been set aside for Vermont patients. And then also just that this has never gotten any traction in the legislature because they see it as an end run around their kind of tight control over the qualifying conditions. So just recognize that, you know, it's not just a yes, it should be a yes. And how do we kind of navigate those concerns? So Nellie, I mean, if you could just continue with the order.
Yep, can do. Meredith is next.
Hi there. Thanks, guys. I wanted to say that as far as conditions go, had a little conversation with somebody about the idea of it being more symptom focused than illness focused. So it sort of expands the options. I'd be happy to talk about that a little bit more. Also, no patient fees. Love to see no renewal fees, anything that's easier for medical patients. I would love and be honored to have a tier to be able to supply for medical patients. I agree with Tito. It needs to be easy. It needs to be easy for us, easy for them, and it's all about access. The one question it brings up for me as a retailer and a manufacturer is there needs to be some type of tier for it on manufacturing for people to be able to produce those higher potency products. So that would be my thought on that. I stand strong with Amelia that it does need to be affordable and accessible. Accessibility is the game here for as many patients as possible, so they're not limited. I do think there needs to be also some type of further higher bud tender education for that particular, you know, let's just say I had a one lane that was medical patients. That particular person that was handling medical had to have a higher level of cannabis education. So yeah, that's it. I just wanted to say I support that in every way and hope that we can figure something out.
Yeah,
Appreciate
thanks,
it.
Meredith.
Yeah,
Yeah,
thank you.
thank you.
Anytime.
Jessie Lynn.
Hi, everyone. This is Jessie Lynn. I am a nurse and I have a lot to say, but I'll try to make it quick and concise. I do like to always remind people that 7 out of 10 Americans take pharmaceuticals on a regular basis. Less than 1% of Americans are registered medical cannabis patients. So reminding us all that there are a lot of patients who are using adult use consumers using medicinally, just not calling it medical, especially here in Vermont. There are a lot of reasons not to sign up for our medical program. I know you guys were originally just trying to address finances, so I want to mention a few things of that. I agree with Caleb that it's very hard to hear former medical dispensary managers and staff talk about reducing fees when we have been rated a D according to American Safe Access. We have some of the highest prices, making cannabis completely unaffordable. I would suggest a price cap, so medical dispensaries can only charge so much for products to keep that within reason, as well as the state, not individual dispensaries, deciding on what kind of financial aid programs that they have and need to have. I also want to remind everybody that our medical dispensaries have no mandated third party or contaminant lab testing. So we have to address consumer safety first thing. We also know that our medical dispensaries don't have a mandated education program that is up to par that we need to be working on. I think so many of the problems and issues addressed and talked about today stem from an enormous lack of education. You guys asked the question as to, can you grow your cannabis and outdoors and use it for a year as a patient? You cannot if you do not have the education. One of the biggest problems that happens in cannabis is after you harvest, during your drying and curing. If you do not have that education, you cannot maintain cannabis in a safe space for consumption for much longer than a month or a couple of months. If you have that education, you absolutely can store cannabis for over a year without quality concern. So again, we are right back to education. When we're talking about the money, again, I'm trying to keep it focused on that. We know that there's medical program money that has not been used in the ways that it can be used successfully. I'd love to see the idea of a co-op run dispensary system to help the caregiver supported system. I've also done the calculations with the amount of money we make in our medical program. We could easily employ a full-time nurse or medical professional in every medical dispensary. They have never thought, or put any money in that towards really supporting patients with some educated professionals. I'd like to address the one concern that somebody had mentioned. They'd like to see Lindsay continue as medical director. I would like to put in a plug for, if we're going to have a medical director, let's actually have someone who has a medical background and some education. As much as there are people who might have a great experience with Lindsay, I think there are people who would suggest changing that situation and looking at someone with much more medical expertise. Also, somebody mentioned some research and having things available at schools, at retirement centers. I would love Vermont, as Massachusetts is doing right now, to look at having a research license in the future, as well as an on-site consumption, not just for events for adult use, but again, for retirement homes and schools and things like that. I can train the nurses. We have a program already through the American Nurse Association here in Vermont, training nurses. So we really need to look at that. You guys mentioned something about conditions. My big plug for that is, where else in the medical world do we tell doctors they can decide, or they do not get to prescribe certain medication unless it's a certain condition? Even when pharmaceuticals are not necessarily made for that condition, they are allowed to prescribe it anyway, to see how it goes, based on the fact that we trust them as a medical professional to make that decision. So in my mind, we should not have conditions. We should be allowing the healthcare professionals who are licensed by the state of Vermont to make those decisions, but we need to recognize those healthcare professionals do not have any cannabis knowledge or education. So I will go back to what I've said in the past. To prescribe Suboxone here in the state of Vermont, you have to take a course so that you are educated. I would do the same thing here in Vermont, to look at some kind of education. Unfortunately, not a lot of people know nurses and medical doctors in the state of Vermont need zero continuing education to continue licensure, which is very different than many other states. So many of our doctors, nurses, and medical professionals here do not have the information we need, and we need to start asking them to educate themselves to help with this medical program moving forward. Reciprocity, of course, I would absolutely say yes, and remembering that we are just a tourist state, and we are becoming more and more of a baby boomer state, as is the rest of the country. And we want to see patients here continue their cannabis and medicine, and not here run to a pharmacy and jump back on their opioids or other medication when their cannabis isn't successful. And then we have our healthcare and our hospital systems dealing with those repercussions here. So yes, absolutely, please do reciprocity. I think that was most of what I had to say. So I tried to go quick and concise, but I always have more to say. And a lot of what I have to say, you have hopefully heard in the past, because I have tend to not be silent. So thank you guys again for listening and for having the roundtable.
Yeah, thanks for joining us, Jessie Lynn. I know you're busy.
Carolyn is next.
Hi guys, as you know, I used to work for the CCB and I'm now at ADS. I just wanted to listen in to see how this is going because I know the medical program is taking quite a bit of shape here, and it's really important. So I wanted to kind of remind some of you, some of the things that you're bringing up is borderline growing, not cultivating for as a caregiver. Um, and as somebody who ran the finances for the CCB, I'll let you know that there was not really any spending money. I don't know where Jessie Lynn got these numbers from or what she was privy to because a lot of our information is not is only private and it goes to the state. So all the money that comes in goes to the state. It's not money that we can just spend and throw away. And there was very little to actually be giving to these things. So I don't know where that came from. And also we had some numbers about that there were only about 400 caregivers, but only about 70 people within that group had noted that they wanted to cultivate. So at this point, I think it's very important for the CCB to really pay attention to the caregivers and even allowing caregivers for anybody who um, is not able to cultivate for themselves. That's possible, especially like an adult. Um, but I do not think that caregivers should be allowed to do as much as they're doing right now, and especially like caring for multiple patients and growing for multiple patients. Because at that point, why don't you just apply for a cultivation license? I know you probably don't want to pay those fees, but you know that it's not much in reality. I think you guys are doing a great job, and I think that the medical team that they have now is doing a great job. And I know there's always room for improvement, and I know the medical team there has always wanted to improve the system. It's hard with DPS and people who are not very cannabis friendly, but I think you guys will do just fine. Just I would recommend trying to bring the fees down a little bit because it's always been weird that like people don't go to like a pharmacy and have to pay much more than like what their prescription would be. So it's kind of weird to then like not just require them to be paying for a high amount for the card, but then also go to like their quote unquote pharmacy, the dispensary to go buy the item, especially when some of these patients have cancer or, MS and other lifelong issues or anxiety and things like that. And I think it was very strange that the state of Vermont has such a small amount of people who are able to be qualified for medical. I know that the medical staff is very generous and very understanding and works with patients and with doctors if people do apply, um, because right now it's pretty much just classified as, pain is pretty much the top one. But people who have anxiety and other issues like arthritis is a huge one. So I would just start looking at even like New Hampshire has more accessible options to be able to get a cannabis card. Um, so I would just kind of like recommend looking at other states and see what they are qualifying, to get a better understanding of like perhaps what Vermont should start including. I yield my time.
Thanks, Carolyn. Nellie, we are kind of quickly running out of time here. Again, I would just mention we do have another one of these tomorrow at 6 o'clock. I really appreciate everything, people's willingness to kind of devote an hour of their day today, and hopefully you can come back with us tomorrow at 6 o'clock. But Nellie, if you could maybe just, if there are, people that haven't commented already, first-time commenters, if you could start with them and then go through.
That was my plan.
Great,
So
thank
yeah, no problem. Next we have Fran.
Hi, thank you for taking my comments today. First of all, I would like to agree with Jessalyn, Amelia, Meredith, Caleb, and Tito, pretty much with what they said today. One of the things I can inform you, you asked a question about whether patients pay main caregivers. They do indeed pay main caregivers directly. They have a system that's worked out very well for that for a number of years. I am a proponent of looking at that system. And as a matter of fact, if you go back about 2 years, it was pretty much perfect. And we can put you in touch with those caregivers. The other thing I would point out is when we talk about patient plant limits, The vertically integrated corporations that have the current 5 licenses have no limit on what they can grow for a medical patient. Ergo, I do not see a reason why we have to put severe limits on this. The size of the grow will determine that, and most people don't have huge facilities to do this with. It's going to be a small operation, and I think that if we go with 3 patients to 5 patients with a rotating patient, that would be fine. So today, I'll let that go, and I'll make more comments tomorrow. Thank you very much.
Fran, do you mind? Sorry, can I ask you a question?
Sure.
You know, the vast majority of our caregivers in the state are very personally connected with their patient. They're usually either a son or a daughter or a father or mother. You know, I'm wondering if we start to move towards this kind of compensated caregiver program where there might be a 1-to-5 ratio or something like that. You know, how do the caregivers get connected with the patients? Are they allowed to advertise? Is it the job of the board to help try and facilitate those
well, I have never
introductions?
been a licensed caregiver. Yeah, I've never been a licensed caregiver, but I am a consultant, and it primarily was word of mouth from people that knew that I was working as an advocate for patients over the years. So I would connect with patients with caregivers, and as I've mentioned before, we used Maine caregivers because they were providing a clean, effective, and affordable product that these cancer patients, mostly in Parkinson's or MS patients, could access. Again, I'm not going to get into the negatives today, but I think we need to take this a program and make it pro-patient all the way, have the administrators reach out to patients, see what they need, connect them with these people, have people that are willing to do this, connect with you and connect with the system rather than having administrators do a perfunctory function as they did with the DPS. We need to basically take out that containment and control factor and put in an embracing factor for patients.
Thanks, Fran.
Yeah, and one more thing, if I may.
Oh yeah, sure.
Just when you talk about the number of caregivers out there, you're talking about the registered caregivers. And what Amelia's talking about are all the people that don't have a license that have been helping people over the years. Thank you.
Right. Yeah. Good point. Nellie, do we have any kind of unique first-time commenters left?
No, everybody who's got their hand raised now has previously commented.
Okay, well, I hate to have to call this meeting just kind of when we were getting a nice rhythm, honestly. You know, it's clear to me that, you know, 1 hour here, 1 hour tomorrow is not enough. So Julie, Kyle, and I will kind of get back together and, you know, consolidate what we've heard over the next, you know, today and tomorrow, and then have another one of these where people can kind of interact with us as we start to kind of formulate some opinions and policy choices. I'll leave it here for now, only because we all have another meeting right now, and hopefully, you know, people can join us tomorrow. I really appreciate everyone spending their time with us today.
Thank you.
All right.
Thank you for having us.
Thank you.